So we're going to just finish this session by introducing the best scientific paper of the cancer imaging abstracts, basically. So I'd like to introduce Dr. Tian Liu, who is from Cornell University. So I'm going to give you some brief biography. I mean, this guy is very young, but he has a PhD in biomedical engineering from Cornell University. So he trained there, basically, and he developed during his studies a method he's going to present to us today called quantitative susceptibility mapping using MRI, and he did multiple publications on this, over 20. And he was also nominated for the Young Investigator Award at the ISMRM in 2012. So, and now he's working actually in collaboration with Well from a startup company called MedImageMetric, and which has been awarded an SBIR grant from NIH. So congratulations. So we would like to hear a little bit about your method here. So before that, I'd like to give you a certificate. There will be a check eventually coming up in the afternoon.
I'm expecting the $100.
Big check. Okay.
Thank you.
Just take this. Take this.
So thank you very much for giving me this opportunity to talk about some of our recent work on quantitative susceptibility, on using quantitative susceptibility mapping to quantify contrast agents in a mouse prostate cancer model. So I think here we all agree that quantifying contrast agent is of paramount importance in molecular imaging. For example, in preclinical studies, quantifying contrast agent is a crucial means to evaluate the absorption, distribution, metabolism, and excretion of various drug delivery vehicles. And contrast agent is routinely used in clinical studies. It is estimated that 50% of the MRI are performed with a contrast agent injection. So evaluating the contrast agent uptake will allow us to determine the cerebral blood volume, mean transit time, K-chance, all important parameters for assessing the tumor malignancy. So among all the molecular imaging modalities, such as PET, SPECT, CT, fluorescence imaging, all the great modalities, MRI has its unique advantage. It provides not only the anatomical information, but also physiological information about the tissue. And also contrast-enhanced MRI is able to clearly differentiate the normal and the diseased organs. And all these benefits come without any ionizing radiation, and a lot of techniques in developing MRI are directly translatable to patient care. With all the good news, but there is always some myth about quantitative MRI. Right now, we are living in a digital world, and all the images are digitized. So a naive thinking may go, any image that provides a number can be regarded as quantitative. However, that's not true, definitely not true. It has long been recognized that there are some inherent limitations regarding using relaxation-based method to quantify contrast agents in MRI. In these methods, it is generally assumed that there is a linear relationship between the contrast agent concentration with the relaxivity. However, the proportionality of the relaxivity depends on the local environment that the contrast agent is experiencing. So sometimes even an additional calibration scan is inadequate to mimic the local environment. Furthermore, well, as shown here in the middle figure, I have a pointer here. Yep. And then furthermore, this assumption, this linearity assumption breaks down when the contrast agent has insufficient interaction with the surrounding water molecules, leading to the well-known T1 or T2 quenching effect, as shown in the last figure. So we ask ourselves, since T1 or T2 mapping is problematic, do we have any way around this problem? Well, luckily, the contrast agents, no matter this is a gadolinium-based or this is a SPIO, meaning a superparamagnetic iron oxide nanoparticles-based, they are very versatile. They are able not only to change the T1, T2, the relaxation parameters, they are also able to perturb the magnetic field. The degree of perturbation of the magnetic field, also known as the field inhomogeneity, provides a great opportunity for us to quantify the susceptibility of the contrast agents. a big advantage of this magnetic field in homogeneity is that this is a long-range field. So even the water molecules are not in contact with the contrast agents, they are still able to sense that the hydrogen protons are still able to sense the magnetic fields induced by the contrast agents. So this will bypass this quenching problem. And all the fields are reliably recorded by the MRI signal phase. At a given field strength, the susceptibility is actually linearly proportional to the contrast agent concentration. So this opens a new avenue for our endeavor. Compared to T1, T2, these traditional relaxation-based methods, quantitative susceptibility mapping is a relatively new imaging modality. So here I'd like to just take a few moments to briefly give an overview of what a quantitative susceptibility mapping is. So QSM provides a novel contrast mechanism in MRI that's different from traditional T1 weighted, T2 weighted, T2 star weighted, or even susceptibility weighted imagings. The voxel intensity in QSM directly reflects the apparent magnetic susceptibility of the underlying tissue, which is useful for chemical identification and quantification of specific biomarkers. For example, iron. Iron is highly paramagnetic. So if we look at the QSM image here in the basal ganglia, it is very bright, indicating high susceptibility, most likely coming from iron deposition. Besides iron, QSM is sensitive to calcification deposit, gadolinium uptake, and also SPIO nanoparticles. So the QSM utilizes the phase images from traditional gradient echo MRI scans and solves a series of inverse problems and generate a three-dimensional spatial distribution of susceptibility. So QSM has been studied, has been explored in the past 4 to 5 years in in the field of neuroimaging. There are several studies have demonstrated that QSM is actually several properties. One, this is a quantitative method, so it works with a wide range of imaging parameters, field strength, and actually MRI manufacturers. And second, it has been shown that it's quite accurate in quantifying iron in the brain. And third, it is actually more sensitive than R2 star based methods in quantifying in terms of iron quantification. So using QSM to quantify contrast agent has also been extensively validated in phantom and in ex vivo studies. So in this phantom validation study, we see that different concentration of SPIO, in this case is Feridex, is embedded in an agarose gel phantom. We already know that the T2 star weighted image, the hypo intensity in the T2 star weighted image doesn't provide a direct quantification of the concentration. And here, even the R2 star map failed to quantify the upper 3 blobs due to the saturation effect. And we also noticed that there is a substantial blooming artifacts on the R2 star map. This problem is solved by the QSM method, and here QSM not only showed a high degree of linearity between the prepared and measured SPIO, but also the quantitative accuracy is excellent. So here is another phantom validation. Here we use the SPIO nanoparticles are also radially labeled with radioisotopes. So we are able to quantify the SPIO not only using QSM, but also using scintillation counts that records the radioactivity. So on the left figure, on figure 1, we see that the T2 star weighted images and also the susceptibility maps of the different concentrations of SPIO. And then we see that with an increasing SPIO concentration, the susceptibility value becomes higher and higher, indicating that it's more paramagnetic. And this quantification agrees very well with the radioactivity measured using the radioisotopes. So in another ex vivo validation study, again, the QSM method, well, in this study, we manually injected known amount of SPIO into excised mouse brains. And in this study, again, QSM is able to capture the super paramagnetic iron oxide nanoparticles in the hemisphere, in the right hemisphere, in this region, as the bright region. And again, the quantitative accuracy is pretty well within less than 10% of error. So we have also performed some preliminary studies in human subjects. And in this study, the pre and post gadolinium T1 weighted image showed an almost uniform enhancement in this meningioma on the patient's right hemisphere. However, on the QSM images, we are able to appreciate the heterogeneity of the tumor with a higher concentration in the periphery, suggesting there are more angiogenesis, and with a slightly darker core, suggesting there is a necrotic core. One advantage of the QSM is that it can actually provide numbers. It can provide quantitative numbers regarding because the concentration of the gadolinium. So we quantify that at the periphery is on the order of about 200 micromolar, and in the middle is about 20 micromolar. So these are these are the results from some of the previous studies. And in this study, we aim to quantify the peptide-targeted gadolinium-based contrast agent in a mouse prostate cancer model. So PC3 human prostate adenocarcinoma cells were inoculated to the left dorsal flank of 4 to 5 weeks old NIH emic male nude mice. After the tumor have grown to 3 to 5 millimeter in diameter, in about 3 weeks, we imaged the mice at a Bruker 70 Tesla scanner. So our imaging protocol is as follows. It basically consists of 2 low-resolution T1 weighted images immediately before and after the contrast agent injection to confirm the arrival of the contrast agents in the tumor. Although we say this is a low resolution, just to remind you, this is actually at a 150 micrometer isotropic resolution. And after the 20 minutes, immediately after the second T1 weighted image scan, we sacrifice the mice and perform a high-resolution QSM scan with a resolution of 100 micron isotropic, and this scan takes about 1 hour. So after MRI, we surgically excise the tumor and digest the tumor with nitric acid and send it to an inductively coupled plasma mass spectrometer to quantify the total amount of gadolinium in the tumor using a method that's independent of MRI. So on the QSM image, we also try to quantify the total amount of gadolinium. So we first convert the susceptibility map into a gadolinium concentration map by dividing the numbers, by dividing the susceptibility number by the molar susceptibility of gadolinium, which is 326 ppm per molar. And then we perform a spatial integral of the gadolinium concentration over the entire tumor. And this is a representative case from our mouse experiment. So on the T1 weighted image, we are able to see that we are able to confirm the contrast enhancement inside the tumor. And then on the QSM image, we see that there is a ring enhancement suggesting that the angiogenesis in the periphery. And we also notice that in the middle, it is quite heterogeneous. And here, this orange oval indicates the region over which we perform the spatial integral to calculate the total amount of gadolinium. So the comparison between between the QSM quantified gadolinium and the ICP-MS quantified gadolinium is summarized in this table. We notice that the QSM and the ICP-MS achieved a reasonable agreement in terms of the tumor volume, which is on the order of 100 microliter, and also the total amount of gadolinium, which is on the order of 10 nanomole. Definitely, we have to acknowledge that there is still substantial difference between these two rows if you pay close attention. So this is still a work in progress, actually. And then one major reason we suspect that lead to this big difference is actually the difference in image segmentation and in the surgical segmentation. So there probably is a mismatch between these two segmentations. So the region over which we try to calculate the total amount of gadolinium, they are different. And also, one known limitation about the QSM method is that at places that's very close to the air-tissue interface, some of the values are unreliable. So despite the limitations, I want to point out two highlights. One is that in this study, we try to use QSM to quantify the amount of gadolinium and actually achieved a reasonable agreement with the ICP-MS, which is regarded as the reference standard here. And we are able to quantify the concentration of gadolinium at the micromolar level. So this actually falls within the same range as the gadolinium concentration we saw previously in the meningioma. So it's a biologically relevant range. We also attribute the high concentration, with such a high concentration of contrast agent, to the use of conjugation with CLT1 peptide, which specifically binds to the fibronectin complexes that are overexpressed in tumor but has a relatively low abundancy in normal tissue. So with some future directions, one of the territory we want to explore is to try to understand what are the factors that influences the detection limit of this QSM method. And then we want to characterize the molar susceptibility of a different type of contrast agent. Hopefully we can find one with a very high molar susceptibility so that it will be easier detectable. And then last but not least, then a standardized in vivo protocol needs to be developed in order to facilitate the translational research to human patients. With that, I'd like to conclude my presentation. I need to thank my funding agency and also thank you for your attention.
Excellent. Thank you very much, Tian. We have maybe time for one quick question. Quick question for you. What is the added value of this method compared to, say, a contrast map of the tumor that can show you also, leakiness or maybe angiogenesis as well? What do you think would be the added value of your technique compared to regular DCE?
Well, I think the added value probably lies in its quantitative nature. It is well known that actually right now a lot of methods, although they try to quantify the gadolinium concentration in order to calculate a lot of important parameters such as cerebral blood volume, mean transit time, and K-chance, but then some of the underlying assumptions are questionable, so that the end result is also becomes questionable. And I think the promising aspect of this QSM method is that through a lot of validation study, we're quite convinced that this provides a quantitative measure of the gadolinium concentration.
You have a question, Anwar?
Yeah, I wondered, it's interesting, but what you're acquiring is the gadolinium concentration at equilibrium, correct? So how does that equilibrium concentration of gadolinium then actually relate to the angiogenic process, which is more about flow and delivery and washout? It's a dynamic process.
Yeah, so this is a very good question. Right now here we actually only showed the images we acquire at equilibrium, but then this is related to the data acquisition. This could be performed using a dynamic data acquisition. So we have some preliminary data, which is not shown here, that will show you like the washing and washed out of the gadolinium.
Okay, okay, quick question.
Thank you much. You have now a Biograph MMR downstairs, and I'm wondering, along the lines of the previous question, if you could use an angiogenesis tracer in conjunction with your quantitative contrast agent measurement, could you learn some additional information?
Well, I hope I could. Otherwise, why am I doing this research? But at this moment, I don't have a very solid answer to your question. But this is definitely under investigation. We're combining dynamic imaging methods and also with this quantitative susceptibility mapping method, trying to see the dynamic curves of the contrast agent.